Lieutenant Governor Cooney, welcome to the show.
Thanks very much, Joe. It's great to be here.
This has got to be the strangest year you've held office in Montana. Tell me about it.
Well, it is. It's been very strange. It just, we have 1 year really, when this really started, we had just a little less than a year in the remainder of our term. And you never really sit there and expect something of this magnitude to happen, to just totally, take over everything just overnight. Very quick shifts in our attention. Although, state government still continues to need to go forward. We still need to, make sure that we're providing services to the people of Montana. But then all of a sudden we're focusing on everything from how do we get the PPE that we need in the state of Montana? How do we prepare our hospitals, both in our larger cities and in our rural areas, to deal with the pandemic? How do you best get information out to the people of Montana so they have a much greater understanding of what this is all going to mean? And then dealing with just the day-to-day issues that cropped up. And so it has been very unusual in many respects. But the bottom line is, this is what government's all about. This is what government is supposed to do. You've got to be able to be agile and nimble and be able to respond quickly to the unexpected.
Sure.
It's not what we wanted, but it's what we're facing, and it's what we're trying desperately hard to deal with every day to make sure we're protecting the people of Montana's health and welfare and the economic welfare of the state as well.
Sure. Yeah, absolutely. Well, when you talk about we, I mean, you're talking about, not only the state health department, not only counties, not only, the citizens of Montana, but, also you and Governor Steve Bullock. You've known Governor Bullock for nearly 30 years. What has it been like working alongside him during this pandemic?
Well, I have known the governor. In fact, a little fact that some people don't possibly remember is that I gave Steve Bullock his first job in state government when he came to work for me when I was Secretary of State. He was my chief legal counsel for about a year before the Attorney General stole him away. So I have known him for a while. And I have to say, it's been a real treat to work side by side with him throughout this administration. But it's been very interesting to watch him during the pandemic and how quickly, again, things had to change just overnight. And all of a sudden you see the governor sitting on the phone, talking to people on a day-to-day basis, trying to make sure that we're getting the right number of masks into the state, making sure that our local health officials are being kept in the loop on what's happening on the state side, talking to school officials about what we need to do in our schools to make sure that our children are safe and healthy, and that our teachers and the people who work in the schools are able to be kept safe. I mean, the whole thing, and the governor's focus really has been on the health and welfare of the people of Montana, and as well as the economic health of Main Street, Montana. They go hand in hand. And the governor is always the first one to remind us you cannot have a healthy economy if we don't have healthy citizens. And so we have to walk that fine line to be able to deal with both of those things at the same time. It's been very interesting to watch the governor and just how this has been consuming. But at the same time, as I said earlier, this is the main focus right now. But other parts of government continue to run. Other parts of government have to continue to provide services to the people, and the governor has to certainly have his finger in all of those areas of governing.
Sure. No, appreciate that. Absolutely. And, that sort of leads me to my next question, and you talk about, the focus of yourself and Governor Bullock right now, the state of Montana. I wonder if you could drill down into that a little more. What are the priorities right now? What are you two discussing at the state level regarding COVID-19?
Sure. Well, again, it's changes from day to day. Right now, obviously we're seeing cases in Montana start to go up. And we're watching that very carefully on a day-to-day basis. At the same time, we're also focusing a great deal of our time and attention on making sure that we have testing capabilities out there throughout the state. One of the reasons I think Montana has been as successful as we have is we've been able to, first of all, when it first happened, we were very focused on making sure we had the right personal protection equipment and making sure Montana's equipment needs were being met. And that meant testing equipment, face masks, gloves, gowns, all of those things. Now that we've been able to do pretty well there, we've been able to focus on how do we get testing out into communities throughout the state. The governor has a goal of over 60,000 tests a year, and we're building, 60,000 tests a month, and we're building up to that. We're finding that it's very important as we do that to make sure that we test the people. As we see new cases come up, we're doing the trace monitoring as well to make sure that we can find people who've been exposed to anybody who may be testing positive. And so these are the things that we're focusing on now. At the same time, we're talking about how to, we really hope that we can see schools reopen in the fall. We want to make sure we're having those conversations with school districts throughout the state so they can be prepared now and work toward a good plan to open up the schools in the fall. So it's really a number of areas that we're working on right now in our focus. And then obviously the CARES Act money is awfully big, and we want to make sure that we're getting that $1.25 billion out on the street as quickly as possible. And we've been very busy doing that. I think $56 million up to this point has been put out on the streets to, I think, over 6,000 businesses. And so we're still working very hard to make sure that we're dealing with those needs as well, trying to keep the economy in Montana on the level. Sure.
No, that's thorough, and that's a lot that you all are working on, and we can all certainly appreciate that. Well, going back to, you mentioned testing there. According to a recent Harvard and NPR study, Montana is among 4 states that are nearing the amount of testing needed to begin suppressing COVID-19, excuse me. You said the goal is 60,000 a month. That study, that Harvard NPR study, identified that it said 3,792 tests per 100,000 people is the ideal. Is this an accurate calculation? And where do we stand as Montanans, in the eyes of the state government? Do we have enough tests?
Yeah, well, I mean, we're always having to work hard to make sure that we have the right materials for testing, and it's something that we're focusing on every day. I can't tell you right now that we have all the testing materials we need to get us through the next several months. That's not the case. We're constantly working on a day-to-day basis, working with companies to make sure we have the right materials so that we continue to do the testing that we think is necessary. Again, 60,000 tests a month is a lofty goal, but we're getting out there, we're getting in communities. When this first hit, you'll remember, we didn't have enough tests. We were barely able to test people who were showing symptoms. There were some people that weren't getting tests, even if they were showing some symptoms. That was totally unacceptable. Now we're in a position where we can actually get tests out in communities, and we have focused a lot of our attention on tribal areas, nursing homes, long care living facilities, and gateway communities in the state where we know we're going to have a lot of activities in the state at this time of the year. So, but we're reaching out as far and wide as we can to communities, and when they make requests, we're trying to make sure they have the capability. And so we're working hard to make sure that testing is important. Along with testing, that puts pressure on us to do the contact tracing as well. As we find people that are testing positive, they may be asymptomatic, they may have symptoms, but the bottom line is we need to make sure we're doing the contact tracing and getting people isolated as quickly as possible. That is the best way that we can stay on top of it. At the same time, we need to convince Montanans that this virus is here. It's serious. We need to make sure that all of us are doing everything we can, washing our hands, making sure we're keeping socially distant from each other, avoiding large crowds, wearing our face masks. Those are going to be very important as we continue this fight against this virus, as well as the efforts we have put forward on testing and just keeping on top of symptomatic people.
Sure. Sure. Well, and that is important. And PPE and all of this contact tracing, I mean, it takes resources, it takes dollars. Looking at Gallatin County right now, for example, and our higher case numbers, how are you all deciding who gets the funding? I mean, is it population based? Is it based on case numbers? How does that decision making go?
Yeah. Well, we've been trying to, I mean, when it comes to the CARES Act money, I mean, a lot of that is focused on businesses to try to get them, some resources so that they can continue to operate. And I mean, there's a multitude of programs that we've set up through the CARES Act to get dollars out on the ground as quickly as possible. But communities, if they're in need of resources, we're more than happy to have communities reach out, and we're working with them to make sure that they have the things that they need. And it's and we're trying to deal with communities where they are finding specific needs, where we've had higher rates of COVID occurring. And I just have to say, our local public health officials have been doing a phenomenal job. And I noticed Matt Kelly is on now with us, and I'm not saying that because he's here, but they have done incredible work throughout the state in local counties to make sure they're dealing with this and keeping us informed of what their needs are. And we're trying very quickly, whether it's PPE or other types of things that they may need, to try to do our darndest to make sure we're able to respond to that.
Gotcha. Thank you. Yeah. Well, you mentioned education. I know you guys have been working on a plan. You've published a plan on the state website. You mentioned during a July 2nd press conference that you and Governor Bullock are urging schools to open safely if possible. What does education look like this fall, and how did you come up with the plan?
Yeah, thank you. It's a good question. I mean, first of all, we came up with the plan. People were saying to us, look, the governor is the person who is, can, under the emergency authority, he can open or he can close schools as he did in the past, this last, when COVID hit the state. But he also then decided that we got to a point where he said local school officials could make the decision on when to open up. We know that when, kids really need to have school. I mean, that's a great place for them to be. It's where they learn. It allows their parents to get back to work, and it's the right thing to do. But we need to make sure we're doing it in a way that people can be assured of their health is maintained, they're safe, and that's a tall order under the current situation. What we did was we sat down with educators and superintendents, school nurses. We sat down with labor union officials who work with schools, and a number of other people, and basically listened to them and heard what they had to say about what they felt it would take to open up our schools safely, and what sorts of things they felt good guidance and directives that should come from the governor's office, because they felt that that's where people would really look carefully as they were considering what plans they needed to make in order to open their schools safely. So in there, I mean, one of the things we just want to stress is, first of all, every school district is going to have their own unique challenges, and we need to make sure that they are working closely with their local health authorities, and first and foremost. Then they can look through the guidelines that we've put out, and there are a number of other guidelines that we've referred people to, whether it's the CDC, the High School Association, Superintendent of Public Instruction, whatever. But and I know that there are going to continue to be other resources out there. We just think that the more the merrier. It gives people better options, and they can really fine tune things to best fit their needs in their local communities. And we think that putting all this together, kids should be able to return to school safely. Parents can be, they can know that that we have a good plan in place. We've asked them to put a good safety and health plan together to share it with their community so parents would know. And then it will deal with kids who can go to the classroom, kids who may not be able to go to the classroom because they may have other health issues that, they shouldn't be around other people, or they may have people living in their households that they need to be concerned about. And so we tried to address all of these things, but in a way not being prescriptive, but being, these are good ideas, these are best practices. But again, communities need to look at their specific needs and choose the things that they need in order to open up their schools safely in their areas.
Yeah, it's a complicated one that you guys are cracking into. Obviously, statewide, but nationwide too. Everyone is dealing with a lot of unknowns, as we know.
I think, really, I think that's really one of the important things. I mean, we have not dealt with a pandemic like this in our lifetime. And, so we're all learning as we go. And when this first happened, everybody was looking at what was happening in other parts of the country, and we were all trying to figure out the best way to go, what the best thing to do in our local area. And so, but now that we've had a little time, we're learning more about the virus. We're learning more about, how we need to be dealing with things. So I think we're in a much better position in order to be where we are today in order to address the situation we're looking at.
Yeah, sure. Well, Lieutenant Governor, I just had a question or two more for you. Your grandfather served as Montana governor from 1933 to 1935. What would he say if he were sitting in that position today, as this pandemic ravages the nation?
I never knew my grandfather. He died long before I was born.
Sure.
And so I'm not quite sure. I'm sure though, I was thinking about what he might be thinking about where we are today. And when he became governor, we were in the beginning and kind of in the middle of the Great Depression. And so, I mean, his focus, reading the history of Montana back then, was really how to get Montanans back to work and how to deal with the economic tragedy that everybody was suffering. And in some respects, I'm sure he would look at today and say, this is not a lot unlike what I was dealing with, because we're dealing with an economic situation where people are hurting. And how do we deal with, getting people back to work safely and healthy, and making sure that we can sustain that. I have to say, when I was growing up, when I was much younger, more people knew that my grandfather was governor. And they'd say, oh, your grandfather was governor. What's that like? And I thought everybody's grandfather had probably been governor. It made no difference to me. But no, I have to say, having looked at the history and read the history back then, I would have to say that he would think, been there, done that. It just wasn't a pandemic. It was a national, depression, the Great Depression. And but people were hurting, and in very similar ways as we're seeing today. So I'm sure he would just be saying it may be a little bit like deja vu.
Mm-hmm. Well, a quick follow up to that. Newspaper headlines eventually read things are back in some capacity. This is a bit of a different situation considerably. When do newspaper headlines again read, back to normal?
Yeah.
Or do they?
I think all of us are very anxious for that. Everybody's getting very tired of this virus and how it's affected our lives, and just our everyday lives of doing simple things have changed. So, but my advice to Montanans is we cannot let up. We have to be vigilant. It's going to be up to us to get to that point where the headline may be life returns to a more normal way of life. But it means that we've got to take care of ourselves. We've got to avoid large groups. We've got to, stem the tide of the spread of this virus. That means wearing masks. That means avoiding large crowds. And it won't be until we see this virus start to really wane and we're on the right path, and we see several, a period of time where the number of cases are going down, so I guess my point is this. I don't want people in Montana to really think that this is going to happen anytime soon. But if we all work together now and make progress each and every day, it will happen sooner than later. And I think that's the important thing to remember.
And you would say that would be us edging closer to a phase 3 reopening, as opposed to stepping backward as some states have done.
Well, I think our goal is to always, try to get us to, a phase 3 as soon as possible. But we have to make sure that we're doing it the right way. And we're going to continue to take steps through testing and through our vigilance in dealing with these cases. As we see the current rise that we're dealing with, we're gonna continue to deal with that, because the last thing we want to do is edge backwards. We don't want to go there. We want to continue through all of us in Montana working together, getting to the point where we're going to be able to say we're closer to phase 3. We want to continue to make our progress towards phase 3. That's what our focus needs to be. That's what our focus is going to be. But we're going to be vigilant as we see these cases where they are now, because they do concern us.
Gotcha. Sure. Well, thank you, Lieutenant Governor. I think we have time for one audience question, if we've got one. Brandon, any questions from our viewers?
Yes, absolutely. And thank you for joining us, Lieutenant Governor Cooney.
Thanks, Brandon.
From Mike asks, can you please explain the role that the state has played in managing the COVID situation versus that of the federal government?
Yeah. Well, this has been a learning experience for all of us. And I have to say, early on, for sure, there has been some real frustrations in working with the federal government as far as us working to get PPE and different supplies and just getting information as we need. I mean, one of the things is, I think that people are looking to this state for more direct information. We're trying to make sure that Montanans have good information. We are saying, without any question, wear masks. That makes a big difference. I wish we could get that kind of a statement from the federal government, but it's been a bit of a struggle. We're getting a lot of mixed signals regarding that. The virus is here. It's very nasty stuff to deal with. We've seen, we got to a point where we were very, I think numbers were looking really good. Hospitalizations were one of the lowest in the nation for hospitalization. And we want to continue to work our way toward those goals of seeing us make progress fighting this virus. So we think as a state, the way we've communicated with the people of Montana has been very helpful. We'd like to see better communication from the federal government and a more consistent message from the federal government. But I think throughout all the states, people are looking specifically to the states for that kind of information. We're going to continue to do it and work hard to make sure Montanans know what's happening and what they should be doing. And we're going to be living that experience right along with them. I've got my mask right in my pocket.
Perfect. Thank you for that.
You bet.
Yes, absolutely. Thank you, Lieutenant Governor Cooney, for joining us. It's been an honor. It's been fantastic, hearing your point of view, and we really appreciate your time today.
Thank you all very much. And I have to jump off, but I want to wish all the other panelists all the best and have a great program.